walk you through on my presentation entitled Combating Antimicrobial Resistance in Animal Health, and some of the strategies that could help us to sustainably combat the AMR threat. So this webinar will take us 1 hour. So as much as possible, I will try to be more interactive with you. So please post your questions in Q&A, or you can also speak through your mic if you want to interrupt and pose a question. So this will be my agenda that I want to talk about. I have some primary goal, why we are here, and also some background information, general background, and also some background that talks about global impacts and global action regarding AMR threat. And also we will talk about some of the driving factors, particularly in case of animal health, and the One Health perspective of AMR, and also the antimicrobial use in animal health sector, particularly, well, sometimes we call it in agri-food sector, which includes aquatic animals, and also even in plant, because the problem is also there in case of plant production. But I mainly want to focus on the animal health part. And some of the strategies, we'll also discuss on some of the strategies. And we mainly focus on disease prevention and control, particularly at farm level. And our important tool for the AMR prevention is antimicrobial stewardship. So we will also discuss a little bit on that. And maybe particularly at the global level, it could be by the quadripartite. There are some global best practices on AMR. So we will see some of the best practices, and we will conclude by summarizing our presentation. So the primary goal of this presentation or session is just to empower users with a knowledge of what's AMR. Of course, from your profile, I understand that you are familiar with AMR. You are from different discipline. Some of you are in veterinary medicine, and some of you are from public health side. So we all know the One Health principle. So we will discuss more about this, and also this presentation aims at strengthening use engagement, particularly into antimicrobial stewardship and its principle, and what it means and how to apply it. And also, lastly, to demonstrate some of the effective strategies that are currently applied to really globally to really mitigate the AMR impact. So just to say very few background information about antimicrobial resistance. As I said again, you are very familiar with antimicrobial resistance. This is a threat nowadays we are facing at the global level, and this is really a challenge and one of the global, among the global threats. AMR is also one among the top 10 of the health threats. And it's usually, as you know, after the invention of antimicrobial agents, many susceptible bacteria for a particular antimicrobial agent is now becoming resistance from time goes by. And these are factors could be different, ranging from natural to man-made or our use of the available antimicrobials. And as you know, from the basic bacteriology, genes are transferring from the resistance bacteria to susceptible bacteria. And this antimicrobial exposure is also aggravating the resistance strains or very rare resistance strains, as you see it on the right side of the picture. Some very few resistance strains are transferring their genes either through plasmid or other resistance transferring mechanism. So becoming more resistant or dominant strains are nowadays arise. So this is really a significant challenge because, as you know, our interconnectedness of animal, human, and environment is, very much interconnected, and also through the food chain or from the food production chain, these resistance bacteria are also passing to humans and also poses a health threat in humans. Just as a brainstorm, you can post your answer or your ideas, actually not an answer. There is no right or wrong answer in our discussion. So what do you think is antimicrobial resistance, or how can we really, we know it, what an AMR is, what are the risks, but how can we define it? Just I want to give you 2 or 3 or 5 seconds to post your answer. How do you feel what antimicrobial resistance is? So that I will show you what the global quadripartite are saying. So sorry, I couldn't see the chat box or the Q&A box. Maybe Laude, you can stop me if there is some interesting point raised, or if there is any question that needs to be discussed while in the presentation. So, the quadripartites, which is FAO, the World Organization for Animal Health, formerly it is called OIE, and also WHO, and recently the UNEP also joined into the quadripartite. As you know, formerly it is called the tripartite. So more or less the definition of this AMR, or how do they define it, is more or less similar. So the working definition, of course, they have different working definition, particularly which is interested for their agenda or program. But in general, they define it as the ability of microbes to grow in the presence of the class of drugs known as antimicrobials that would normally kill the microbes or limit their microbial growth. So formerly those susceptible to that particular antimicrobials are now becoming resistant. So this is the general definition those quadripartites are using. Just to show you the global burden of AMR, how it looks like. As you know, nowadays, you might have heard of this, the 700 picture and the 10 million diseases in 2050. And today it's causing almost 700,000 diseases every year from AMR. So if we are not doing any intervention in the 2050, 2050 is almost, we are 25 years away from 2050. So 10 million, it's really a lot more than any other health threat. And by 2030, particularly in LMIC countries, as you see in the middle picture, the livestock production falls by 10%. You see, it's really a lot of loss in the terms of production because of antimicrobial resistance. And the problem, particularly in LMIC, is they are also increasing their antimicrobial use in animals or in livestock production, which is one of the aggravating factors that we will discuss later on. So the production decreases, and also the antimicrobial resistance also increases as the antimicrobial use increase, particularly in LMIC countries. And also the cost or the global expenditure, as you can see, the picture over here, almost 25 million more people who are forced to be in extreme poverty due to AMR. So it is really a global burden that we are discussing or talking right now. And also in terms of livestock sector, or if you see the livestock sector separately from the human health sector or from the environment sector, by 2050, the World Bank estimated that almost 11% loss in the livestock production. This is really a lot, particularly it affects the developing countries. And also the global GDP will be shrinks by 3.5%. And also due to the antimicrobials currently not really curing diseases in animal. So the suffering of animals, the welfare is also severely affected. As you know, AMR pathogens are also zoonotic, are transmitted from humans to animals or from animals to humans. So controlling zoonotic diseases could be very much difficult. And again, the economic impact, as we said earlier, trade, particularly animal trade, live animal trade or meat trade could also be affected and resulting in economic crisis. And also the cost due to increased treatment failure is also really incurs, particularly the poor farmers. It affects the poor farmers because of this treatment failure, because the currently available medicines or available drugs are really run out of use because of this AMR, and there is a decrease in the export of animals in the animal products, as I said earlier. So we have seen the impact. We have seen what's the global impact or the global burden of AMR. So what could be the global action to combat AMR? So I would really want to discuss at least 5 global action that are taken as a good step to combat AMR. The first one is the One Health approach. As you know, the One Health approach is really believed to be one of the good tool or the good instrument or the good approach to combat complex health problems such as AMR. So that can be really addressed by One Health approach. So this is one of the actions that is taken, and countries are really encouraged after 2015, the World Health Assembly were conducted, and during that time this World Health Assembly really discusses high-level health related issues. So at 2015 World Health Assembly, AMR was really discussed at high level, and this discussion brought up the global action plan so that countries will adapt their national action plan, that we call it NAP. So there is a gap which is called the Global Action Plan. So from this Global Action Plan, countries are encouraged to develop their NAP, which is a National Action Plan, to really mitigate the problem of AMR. So there are so many countries, including many African countries, developed their National Action Plan. They have the activities to conduct in midterm, in short term, long term, and medium term, so that they can achieve their target in decreasing AMR. And the other global action is a quadripartite joint secretariat is established. This joint secretariat is based at hosted by WHO, but the quadripartite, as I said, WHO, FAO, UNEP, or the United Nations Environmental Program, and WHA, the World Organization for Animal Health, they are also joining hands to combat AMR. So this is one of the good global action to combat AMR. And the other one is high-level meetings. Since March 2022, the United Nations General Assembly also convened on AMR, particularly on AMR. And very recently, last year on September 2024, high-level meeting also happened at the United Nations, New York, as the General Assembly, discussing this hot topic of AMR. And the other global action is the World Antimicrobial Resistance Awareness Week, or World AMR Awareness Week. We call it WOW. So WOW is celebrated every year from 18 to 24 November to discuss or to raise awareness on the public or on any stakeholder. It could be the policymakers, and this really achieves a lot, this WOW event. As you can see from the picture, the quadripartite leaders, they agree to work together on AMR. So this is really one of the good steps to combat AMR. So what could be the driving factor for AMR? What do you think that the drivers for increasing the AMR issue? Maybe I can stop just for 5 seconds to for you to think of what could or what could be some of the drivers of increasing the AMR burden, particularly in animal health sector.
Okay, so I wanted to point out that the first question you asked, a lot of them gave their responses on their definitions of antimicrobial resistance. And then the new question they're asking now, someone said, Christiana said lack of awareness. And Victor said inconsistent use of antimicrobials. And Chidima said indiscriminate use of antimicrobials. Pauline said underdose and overdose of antibiotics. Henry said poor use of antibiotics results to AMR, like overuse of drugs. Edwin said irresponsible use of antibiotics.
Thank you so much, Alodi. Yes, very nice. Excellent. Yes, you mentioned all of the driving factors for AMR, particularly in animal health sector. Particularly, we can see these drivers into two. Maybe you mentioned almost all of the driving factors. We can categorize what you mentioned into two groups. One is the health system. As you know, the health system or the health system infrastructure is very important for like to mitigate AMR. So if this health system is really not functioning well, it could lead or it could contribute as one of the driving factors for AMR. So let's see some of the health systems that could be considered as a driving factor. For example, wash or the sanitation. This is one of the most important factors that drive AMR in both humans and animals. And also poor IPC or poor infection prevention and control, particularly in healthcare facilities and also in farms. Access to affordable medicine, quality medicine, access to vaccine and diagnostics in both livestock sector and in public health or in human health sector. This is also the driving factor. You mentioned the overuse of antibiotics or antimicrobial agents in general is another driving factor. And also one of the problem in most developing countries is the issue of access to new or access to good quality antibiotics. And also enforcement or legislation is also another important driving factor. And again, diagnostic capacities or capabilities or the lab infrastructure. This is also lacking in most developing countries, particularly the animal health sector is affected by this. So this can be considered as some of the driving factors, as you already mentioned. And the other one is, the other category is from the professional itself. Previously, we have seen it from the animal health infrastructure wise. Now we can see it from the health professionals side. So some of the driving factors in health professional side are lack of awareness and knowledge. Even for the professionals, the awareness and knowledge gap is, I mean, the studies showed so many knowledge, attitude, and the practice gap, and overprescription, use of reserved drugs just to treat very minor infection. And also, in most countries, there is a standard treatment guideline, but there is a problem of adhering to standard treatment guideline is also one of the driving factor from the health professional side, wrong indication, wrong duration, so many things. And also prescribing without microbiological result or without even testing the animal for which disease is the animal is affected or sick. And lack of commitment could also be considered as the driving factor from the health professional side. So I mentioned earlier in my at the beginning, the One Health perspective is really the good approach to really mitigate the this threat of AMR. As you can see, the agriculture, from the agriculture side, from the human side, and also from other sector or from the environment side, there is a link. So there are so many pathways for the these pathogens, resistance pathogens to transmit. It could be, for example, from livestock to humans. It could be through food source or through food animals or through contamination or through environment. You can see from contaminated water. And also in case of wildlife, there is also a interconnectedness. So the One Health perspective of AMR is really important, and it's one of the instrument to address the issue of AMR. So, as you mentioned earlier, antimicrobial use is one of the problem in causing or in aggravating the issue of AMR, particularly in developing countries or in low and middle income countries. So do you think the global use of antimicrobials in animal has increased or decreased in the past year? This is also what I would like to pose as a brainstorming question for you. I will give you 5 seconds, or you can post your question. Sorry, you can post your answer on to this brainstorming question. So do you think in the past 3 or 4 years or in the past decade, do you think the use of antimicrobials increased globally? I hope you posted your reflection on this.
Should I read it out? Should I read it?
Okay, please. Yes.
Yeah, so Farouk said it has decreased. Dauda said it has increased. Victor said it has increased. Paul said it has increased. Chidima said, yes, it has increased. Edwin said it has increased. Abdul Salam said it has decreased. Christiana said it has increased.
Okay, thank you so much for the all of you for your reflection. You know, the antimicrobial use in animals, the data is collected by WHA, or the World Organization for Animal Health. It collects data globally from animal health sector. So surprisingly, the antimicrobial use in animals decreased by 30% in 3 years. This is the data of WHA in 2023. I understand some of you said increased because in the previous slide I showed you the particularly in low and middle income countries, antimicrobial use increased by 67% in animal sector. Yes, that's really alarming, particularly for developing countries. But as a global level, because of so many efforts, and nowadays because the antimicrobial use is, because of this understanding, antimicrobial use also one of the driving factors for AMR, there is a global really initiative to decrease antimicrobial use in animal sector. So this is really one of the wonderful achievement, or one of the really good good things that we can I can say one of the good thing, because the use is decreased in the last 3 years by 30%. So for what purpose are we using antimicrobials in animals, particularly in food animals? The purpose is really diverse. Some of the purpose is really not good, or some of the purpose should not be encouraged or should not be recommended. Of course, there is a recommended antimicrobial use, particularly related to disease or for veterinary purpose or for therapeutic purpose. That is recommended because animal welfare should be respected. We have to treat sick animals. But there is a misconception about antimicrobial use, or there is a wrong way of using it, which is for non-therapeutic use, and in some cases for growth promotion, or they call it antimicrobial growth promotion, or they call it AGP. So in most developing countries, like in most European countries, they ban the use of antimicrobials as a growth promoter. But, you know, one of the issues that I said is regulation or lack of regulation in most developing countries. So antimicrobial growth promoters are also used in the case of animal health sector. So this is also one of the issue. And again, antimicrobial use in animal health is crucial for treating or preventing diseases. But, you know, most countries, as you can see from the picture, in most countries, particularly in Western countries, this picture on the left side is the 2010 picture, and the one is on the right side is 2013. This is a projected one. So in many countries, particularly in developed countries, they really they are doing so many good intervention to decrease the use of antimicrobials. Particularly, for example, as you can see in 2010, in China 23% use. But in 2030, it is increasing, which is not good. But in developing countries like USA, it was 13% in 2010, but they have a plan to decrease their antimicrobial use, particularly in livestock sector, by 10. So this is really 3% decrease is really good. When you see the world, the rest of the world, still it remained quite the same in 2030, but relatively there is the pie is less in 2030 than in 2010. So another question you can see in the in the slides, this question mark, I put it deliberately. Globally manufactured antimicrobials are used in animal. How many % do you think is globally antimicrobials produced are used in animals? Most people, they think antimicrobials used in animals, the percentage is low in animals, but surprisingly, the antimicrobials used or manufactured or intended for animal use is really higher, which is 66% than antimicrobials are produced for human purpose. So this is antimicrobials are really used in the livestock production. So this is really a problem for human health, because through the food chain or through the food production, this antimicrobial resistance is transferred to humans. So the antimicrobial use is also widespread and also inappropriately used, and this causes a risk of antimicrobial resistance selection by pathogens. It could be commensal pathogens or also pathogens. It could be by commensal bacteria or also pathogenic bacteria, and this has adverse effects for humans and so in veterinary medicine. So we have discussed antimicrobial resistance. We have discussed the use, how it looks like globally. And so we have seen the problem. We have seen the driving factors for the problem. So what are some of the strategies for sustainable practice to really combat AMR? So there are globally, the quadripartites, they suggest 5 key effective strategies or 5 key pillars to combat AMR. And one of the pillars is governance and resource allocation. You know, to do AMR work, governance or the involvement of the policymakers or the involvement of decision makers are really important. So strengthening their governance and resource, particularly in countries where the resource is limited, is really important. So this is one of the pillars. And the second pillar is increase stakeholder awareness and engagement. So AMR, the stakeholders of AMR are a lot. Human health sector, animal health sector, environment sector, policy makers, so many stakeholders are involved. So we need to increase the awareness and their engagement for a better change. The third strategy is strengthening the surveillance system, particularly capacitating the laboratories to really generate evidence. It could be through research or it could be through lab-based AMR surveillance or through AMR testing and generating of AMR surveillance data for the decision-making purpose. And the fourth pillar is enabling good practice. You know, prevention is important for AMR. So good practice is really important, particularly infection prevention, interventions are really an important strategy to combat AMR. And the last, but not the least pillar is responsible use, particularly those who are using antimicrobials, they should really use it properly. So these 5 key strategies are believed at global level an important interventions or areas to combat AMR. Maybe in my today's presentation with you, I'm not going to deal with all, for example, surveillance and research or governance, but I will pick few of these strategies and I will discuss with you in the next few slides. So I want to discuss with you the disease prevention and control, particularly at farm level. You know, as you know, the food web or the food chain is from farm to table. So anything happening at the farm level is also happening at the table or through our food chain, it will come to us. So prevention, you know, this picture or from this very old science class, prevention is better than cure. So whenever we do our intervention on prevention, it's really worthy than curing or fighting AMR. So there are so many things can be done at farm level to prevent infection happening. And this leads to not using antimicrobial because the animals are not sick. We are not going to give them antibiotics. So what are some of the good prevention and control strategies at farm level? Maybe if you are a veterinarian, you know the term farm biosecurity, you know biosecurity. So this farm biosecurity means measures that are really aimed at reducing the risk of infectious diseases, either entering into the farm or spreading from one farm to another farm. So this is one of the best disease prevention strategy in animal health sector. So this biosecurity or farm biosecurity reduces the risk of introducing resistance pathogens. We call it external biosecurity, which is preventing the entrance of resistance pathogen into a farm. And another biosecurity is internal biosecurity, which is limiting the spread of resistance pathogen within the farm or from inside of the farm to outside of the farm. So for this, there are so many things that can be done, or we can see from the picture in the left side. Infection can enter or they can leave from one infected farm to another by different means. It could be through humans, it could be through rodents, or it could be through equipment that are used at the farm, or if there is no good biosecurity. Vehicles can also be a good way for disease to enter into another farm or leave from infected farm to a new farm. So biosecurity is one of the good strategy to really mitigate infection, which later on combat AMR. So how can we reduce antibiotic use in farms? We can differentiate basically. I'm not going to go into all the farms, but I picked two farms which are very common, which is the dairy farm and also the poultry farm. So in case of dairy farm, one of the good disease prevention or one of the good means to reduce antimicrobial use is having a clean environment, a comfortable house, a fresh air in the farm could make the animals healthier, productive, and we don't need to use antimicrobials. And the other one is disease spread, as you know, particularly infectious diseases, particularly respiratory infectious diseases, they transmit in very crowded places. So when we really give a good space for animals, then the transmission of infectious disease could be, we can limit the transmission. And the other good strategy is vaccination. We can use vaccination as an alternative to antibiotics when we regularly vaccinate animals by really respecting the vaccination calendar. For example, in farmers, most of the time, it is known when the disease happens. Some of the diseases, they occur seasonally, so we can do a vaccination prior to the animals acquire infection. So vaccination is another good strategy to reduce antibiotic use by preventing infection. And the other one is cleaning the environment of the animal, the dairy cattle where they live. For example, moisture, mud, and manure accumulated in the farm, they are a good habitat for pathogens multiplication and also spread. The other one is in case of poultry farms. What can be done to reduce antibiotic use or antimicrobial use at poultry farm level? The first one is use antibiotics only to treat sick birds. I will discuss later on some of the experiences that we have while working with poultry farmers, producers. They just treat animals, just the assumption of if I treat my animal, then it will be produce a good number of egg, or the weight of the bird or the chicken, just chickens will become good for market weight. But this is really wrong perception. So whenever we use antibiotics, we only need to use for sick animals only. We don't need to use for preventing a disease or as a growth promotion purpose. And of course, vaccination is also one of the best strategy in poultry farms to really prevent and control disease. And regular inspection of the behavior of diseases, the behavior of birds in the farm, in the flock. You know, some animals, they show very unique when they get sick, when they become infected, they show different signs. So we need to, or the farm attendant or the farm veterinarian should really inspect regularly for any sign of infection or altered behavior. And comfortable environment is always important. Feeding good nutritive food and also stocking with healthy chickens. Sometimes when we for example, my experience in Ethiopia, some of the exporters, they brought day-old chick from abroad. And when we bring day-old chick, if we don't know what kind of disease is from the parent stock, then there is a possibility of introducing a disease. So we need to stock our chickens from a known supplier. so that disease will not be introduced into our farmers. And high quality water is also another important. Cleaning, disinfection, keeping a high level of biosecurities are one of the good methods to reduce disease or infection at farm level, so that we can be not tempted to use, or we are not forced to use antibiotics. So the way out for infection control or for infection prevention is this pyramid. As you can see from the pyramid, the base of the pyramid is the one that should be done. The tip of the pyramid is the least that we need to do. So good husbandry practice should come first, then biosecurity should come next, then vaccinating animals. If all those things fail, or if there is infection, or if there is disease in that part, then we need to treat. So, but the treatment should be the last option in our infection prevention strategy. But what is happening now in the ground in most developing countries, this is the inverted pyramid, is the current status. You know, antimicrobial use is they consider it the most easy, but the wrong one. But the good animal health or disease prevention or good animal husbandry practice is coming at the tip of the pyramid, which is the wrong strategy. So I will show you some of the pictures while we are working, because this presentation or this session is also to show you what's happening at ground level, or what is the real examples in most cases. So you can see some of the pictures here. So can you explain what's wrong with this picture? This is the foot bath usage that we took in some of the farms that we are supporting. So you can see in the first picture, the middle picture, and in the third picture. So can you say something about what's wrong with this picture? Can you put your point in the chat box or in the Q&A? Maybe Alaudi, you can help me if there is any point mentioned in the chat or in the Q&A box. Of course, it is very visible, you know, in the first picture, you know, the footpath, which is at the entrance of it should be kept at the entrance of the farm, but, you know, it is not using a proper footpath structure. In the middle picture, you know, they put straw. You know, straws are also organic, so they can dilute the footpath chemical, which really decreases the effectiveness of the foot bath. And in the third picture, you can see he is using the normal shoes that he's wearing it for casual purpose, and also the size of the foot bath container, and his foot is not really proportional, so it doesn't really immerse all of the foot bath chemical. So this is the real examples regarding good farming practice. And the second, the other picture that I want to show you is also about proper cleaning and disinfection of animal house, particularly in the tailed chick. So this is new badges are introduced, but you can see from the arrow, the previous, the debris or fecal material from the previous badge is not properly cleaned before introducing these new badges of birds. So, you know, the infection that is in the previous badge can easily transmit to this newly introduced birds. So a very visible example. And the other one is a feed storage condition. You may put your ideas. We have taken this picture in some of the poultry farms that we are assessing and also supporting regarding biosecurity and proper poultry production. As you can see, this is a feed storage condition. You know, the feed it is not kept in a proper way. Sometimes the animals, the birds and the feed are kept together. So this is really one of the bad examples that shows good farming practice is not really well practiced in most poultry farmers. Again, you can see cleaning and disinfection of farm and premise, because cleaning of the premise is also important. Cleaning of the farm compound is very important. You can see this guy is using his casual clothes to feed the chickens. And you know, the farm compound is also not clean. And the picture on the far left, you can see the droppings from it could be from wild birds. You know, wild birds also able to transmit so many infectious diseases, including Newcastle disease and also highly pathogenic avian influenza. So maybe the farm attendant can just step on this fecal materials and enter without disinfecting to the farm, and causes infection transmission. And some of the example is also access, preventing access from freely roaming animals. It could be abattoir, it could be in butcher, it could be in feed storage facilities. This facility should be really banned from entrance of unauthorized person and also from freely roaming animals, because they can able to spread infection. And disposal of animals is also one of the critical issue and can be considered as the good farming practice bridge, one of the bridges in this regard. And and as you can see from the picture, they just throw them anywhere without properly decontaminating those birds, because some of them could have died of infectious diseases that could easily transmit to others or contaminate the environment. So this is some of the good farming practice examples that shows how the current practice looks like. So when it comes to the AMR, as I mentioned earlier, one of the good way of combating antimicrobial resistance is applying antimicrobial stewardship in animal health sector. As you know, antimicrobial stewardship is a really good concept, or has been implemented in the human health sector for a long time. But you know, the stewardship concept or principles are not as such implemented in the animal health sector. So in our work as at FAO, we have been supporting the veterinary clinics to develop antimicrobial stewardship guideline using these 5 R principles. I will discuss what the 5 R principles are soon, which are reduction, refinement, replacement, review, and responsibility. So having these antimicrobial stewardship guidelines available, then training of frontline animal health professionals who are prescribing antimicrobials, they are also need to be get trained manual how they implement the 5 R principles. And also linking the veterinary clinic in the lab is also very important, because most of the veterinary clinics, they lack laboratory diagnostic facility. So and most of the veterinary clinic, because one animal owner brings so many animals at one time, so it's not easy for a veterinarian to, or for the lab technician to do antimicrobial sensitivity testing, or also basic diagnostic testing. So we are trying to link veterinary clinics with the lab so that they can work together, support each other, so that there will be good antimicrobial prescription for the patient for the right disease, and also for the with lab result, after getting the lab result. And also establishing antimicrobial technical working groups is also one of the areas in case of promoting responsible use of antimicrobials. As I said, the 5 R's, in short, I'm maybe in the interest of time, I'm not going to all of the areas, but responsibility has implication reduction, what we are reducing, what we are replacing, what we are refining, and also we need also to review our prescription to implement the antimicrobial stewardship in animal health care facility. So when we really promote the responsibility of antimicrobials, the antimicrobial stewardship action is really important, because these actions that we are taking individually or collectively will eventually preserve the effectiveness of the currently available antimicrobials, because as most of you know, the last time that we have new antimicrobials it's been a very long, many years. So we need to reserve the effectiveness of the currently available antimicrobials through antimicrobial stewardship. So why does antimicrobial stewardship matter? It matters for so many reasons: for treatment outcome, for food security, for economic and industry, for economic purpose, and for the industry to survive, and also for global and local action. And also antimicrobial stewardship is really matters for One Health, and also for curbing AMR, and also for developing new antimicrobial agents. So this is really an important principle in preventing the antimicrobial resistance issue. So I want to discuss very few points about what are the global best practices to mitigate AMR in the animal health sector. You know, the quadripartites are working in so many areas, particularly in terms of when I talk of what FAO is doing at the global level to mitigate AMR. This farmer field school approach is becoming an important instrument to change the behavior of farmers, producers, veterinarians, to change their disease prevention and control approach, and also on how to properly use antimicrobials when they are only needed for treating infection. So this farmer field school approach is just a learning by doing approach. It is an experimentation approach, and which is a participatory approach. So farmers, they learn each other from the best practices on how to improve good farming practice, on how to improve infection at their farm. So they learn, they come together every week in one school, or which is called a host farm. So that host farm will host the other maybe between 20 to 25 farmers. It could be poultry farmers. So they come together, they learn on how to improve biosecurity, on how to improve infection, and on how to use antimicrobials. So there is a facilitator, which is an expert, but the role of the facilitator is just to guide the farmers, not to teach them. This is not farmer field school is not a formal way of education, but the farmers, they learn from each other, from the best experience. So this farmer field school approach is very important to change the behavior, because one of, as you mentioned in your previous in my brainstorming question, awareness or behavior is one of the factor or the driving factor. So changing the behavior changes the practice. So when you change the practice, then the problem of infection will be decreased, so that the problem of AMR. The
So
other initiative is,
please. So we would appreciate if we could round up in the next 5 minutes because our next presenter is already around. Thank you.
Okay. This is my last slide. So I will finish in 5 minutes. Apologies. So the second good best practice at global level to mitigate AMR is the rhinofarm approach. This rhinofarm approach is to reduce the need of antimicrobials on farmers. You know, if we do our intervention on reducing the need, because we are not buying antimicrobials for free, but when you prevent infection at farm level, then we will really our cost for buying antimicrobials also reduce. So there are so many interventions on this rhinofarm process. Nowadays, many countries across the globe, particularly the developing countries, they are asked to engage in this rhinofarm initiative. The open call for application is submitted by countries from their chief veterinary officer. So a chief veterinary officer will show an interest to participate in the rhinofarm initiative. So the basic principles of this rhinofarm are 5. One is good health service, good production practice, and good alternative, and also incentivizing farmers who are really implementing good animal husbandry to reduce antimicrobial use, and connecting farmers to learn each other is another area of this rhinofarm. So these are the two best global initiatives currently are under implementation at FAO level. So how can we summarize this talk or this presentation, or what can we take to our home? We can summarize it in 3 main pillars. The first one is we already understand AMR is a global issue and One Health approach is really important, and antimicrobial use is the principal driver for antimicrobial or creating antimicrobial resistance. And disease or infection prevention and control, particularly implementing biosecurity measures, are another important tool to prevent antimicrobial resistance at farm level. And if infection prevention fails, and if we need really, if we are in a must position to use antimicrobials, we need to use it rationally or in a prudent manner so that we can save the currently available antimicrobial agents. Thank you so much. Thank you for your patience to listen my presentation. And over to you.
Thank you very, very much, Dr. Belaynehe, for that excellent presentation. We really, really appreciate your time. This is very, very enlightening. I learned a lot throughout the presentation. So I will just give room for 1 or 2 questions before